be connected, and we have a new starting point here. I think we're going to learn a lot. And we don't only are making community, but we have new methodologies to learn. And you have seen me many times talking about these three important pillars. It's not only about moving your hands and doing micro movements, it's about the decision making and the mindset skills you have in that moment doing surgery. We're going to talk a lot about that. So we're going to go fast with these 8 tips. We're going to go fast, but this doesn't mean that they're not important. They're very important. It's very important for you to understand what it is to be a surgeon. That if you want to become a surgeon, there's a journey you want to travel around. You're gonna, prepare yourself the day before. There's gonna be some tips for the day of the surgery. What happens in the OR and the surroundings? Are you connecting correctly? Are you communicating? What about the patient? What about the surgeon that day of the surgery? What about the afterwards? Are you having feedback of what you're doing? And then we're going to go to Phaco dynamics and surgery. Everybody loves that. So the main objective here is go fast in all the tips. And then in next weeks, we're going to go deep in this specific steps. Okay. So the first tip, and we're going to have, I want you to see all the panel because this is an amazing panel. I always make this joke that what is to be a surgeon, right? And that you always need to wear a smile, no matter what, right? It's very, very important to understand what is to be a surgeon. So we have, I'm gonna stop sharing now. So I hope you can see all the panel here. And we have many, many colleagues that have amazing tips about it. So Nigel, you have amazing tips about what is to be a surgeon and how this journey has been, with mentors and to become a cataract surgeon. Can you share with us those concepts?
Yes, thanks, Ivo. I'll try and share my screen. So I've taken on let's see here. Decided to take on the topic of being of the mentor. Not seeing my screen.
Don't worry, Nigel. We can leave it for the moment of the mentor. This was a general question, What do you think, Ben? Ben, what do you think? What is to be a surgeon? You were smiling about always wear a smile. What do you think about that?
Yeah, I think it's really important to always smile. Positivity and everything makes a lot of sense, and especially when things are not going so well, Ivo. That's the time when you can bring your team together if you're smiling and still staying calm and under control. So I think wearing a smile is very important. But with the mentor part, I think a mentor is absolutely essential. And as we've spoken about, Ivo, you don't have to have just one.
Amazing. Milton, you're an amazing surgeon. What do you think about what is to be a surgeon?
May I share my screen?
Of course.
Sure, good. Yes, I'm going to share a little bit of a story here. I love Formula One since I was a kid. I wanted so badly to be an engineer. And I want to share you some stories that correlate to our art and profession. This is a picture, not too fancy, of a very, very ugly car. You don't relate a Formula One car to candy, but this was a mythical race in which a legend was born. And when I change his real helmet, you will recognize him. It was the first race in which Senna was shown to the world, and he was about to overtake the leader of that race in a rainy race. He was about to overtake the first place leader of the race, who was Alain Prost in his McLaren, all powered car. But this rainy race equaled all the drivers, and he was about to overtake the legend Alain Prost. He was to be known as the king of the rain. This is a race in Hungary in which he was already a very known star, and he started in his 6th place at the beginning of the race, and it was a downpour. It was raining dogs and cats, and before the end of the first race, he overtook all the 6 drivers that were ahead of him before the end of the first lap. So he was to be known as the king of the race, and he was a very bad rain racer. And how can that be? During his early years of go-kart racing here in Brazil, he knew he was a very bad rain racer. And every time it rained in São Paulo, he went to the kart racing speedway to train during the race, alone, by himself. So that's how you understand his brand, his logo. It was all about driven to perfection. And this is something that I carry with me all the time. And I'm going to share you 2 tips from the best pros in the world that have everything related to us. And the 2 main tips are fundamentals. I see so many surgeons getting amazed by the latest technologies, etc., but they don't dive into the fundamentals. All my fellows, I required to have manuals of all equipments they are going to handle, and not only have the manuals, they have to read them. And it's something that sounds extraterrestrial, but it's what the pro guys do. Not only in cataract, I mean all the activities in which you expect a pro performance. And the other tip I'm going to share with you that comes from every other area, not only in surgeries, is training. Training as hard as you can. Every time you see a great performer, make no mistake that he has trained a lot. Either an athlete, a race driver, an airplane pilot, all of them, they do train. I would say that they train 10 times more than they do the real thing. So it amazes me that we don't take this as pro surgeons as serious as we should. So these are the 2 tips that I carry, and it comes, I thought it came from Formula One, but as I said, it comes from all the different areas of human expertise. And I'm going to share here the love I have with Formula One. And I was a medical doctor for about 10 years in Formula One, and that's a bit of my story. Thank you.
Thank you very much. Amazing story as always, and I think it shares a lot. It says a lot, right? I love that about always driving to perfection. There is no other way for a surgeon, right? Thank you very much, Milton. That was an amazing story. We're gonna keep going to tip number 2, and I think here it's very important to understand that there is something important what is to be a surgeon, but there's also something very important to understand that it's a journey, and that you always learn something. There's a new technique, new technology. So and also it's a very hard journey, right? I put it like in kind of a joke. It's like climbing Everest. So it could be very important. Ben, you have some very interesting insights about this.
Yeah, thanks, Ivo. I've just got one slide. I'll just keep it really fast. So the journey and the mentor, just two main points really, are that you're never, you know, no matter how good you get at this, you can still improve. You're never going to stop learning and improving. And it's good because progress is life. You know, if we don't keep moving, we die. You've got to keep improving. But it's also bad because you might never feel as though you're the complete master of this art. You'll see new techniques, you'll see people making new videos about how fast they operate or what they do and different techniques. And you might feel as though you can't do all of those techniques. Maybe you can't do horizontal chopping and vertical chopping of a nucleus, something like that. But you don't have to worry. You can either pick those things up and try and improve and find the people that can teach you, and you can find those mentors, or, you know, even just learning about them is improvement. And my other point about mentorship is you need to find someone that keeps pushing you, not pushing you like a parent making you train for sports or something like that, but someone that makes you want to improve, someone that you can talk to about things, someone that's on the same wavelength as you. And there might even be people that are watching now that want to contact us as mentors, and we have mentors above us as well, and it keeps going. And you don't have to have the same person for everything. There might be someone that mentors you in your business. There might be someone that mentors you with cataract or laser surgery, and you can have different mentors. So for me, I think having a mentor has been absolutely essential. I'm not the best at pushing myself, and I'd like someone else to keep talking to me and pushing me. And to me, I think you can't make this journey alone. You really need someone to help guide you and help push you along. So that's all I've got for mentorship. I've got some other slides, but I will. I'll talk about them.
Yeah, you can share them later in that tip. Dr. Harry Wijayanto also have amazing tips about what is to be a surgeon and about this journey. Doctor, it's an honor to have you from that far away with us. Thank you for being here.
Yeah, thank you, Dr. Ivo. I think I'm the only panelist here that I'm still a beginner phaco surgeon. Okay, can you show my slide?
Yes.
Oh.
Yes, you can share it.
The journey and the man. Yeah. The journey, I think in the journey is about the curve of learning. So it's related with syllabus and curriculum. So we can get our target. My journey as common journey, I do wet lab first, and then I learn with manual cataract surgery. So I imagine that manual cataract surgery like riding bicycle, not Formula One car. So we can minimize the complication. And then I learned by training kits, Kitaro, dry lab and wet lab. And then I learned with supervised mentor. I think if we can do manual cataract surgery, we need add our skill in coordinating between pedals and eyes, ears, and our left and right hand. I want in this discussion we discuss the issue that we as a phaco beginner needs a lot of hands-on, but we need lots of ideal patient. But how to get the enough ideal patient, I think is very need a long time, need more time to have an ideal patient. Thank you.
Thank you very much. Thank you very much, Harry. Amazing, amazing things. So you can stop sharing now. And Nigel, I hope you're ready. You have amazing also concepts about
Yes.
mentorship.
Yeah, all right. Yes, stop sharing.
Perfect. Then we can see them.
So I just looked at definitions of mentorship, and we basically covered them. The difference between a mentor and a role model, and one person may have both characteristics, or they may be separate. And the concept of scaffolding, which has been mentioned, and where you break down complex skills into smaller units and then you combine them into the complete procedure. And that's how traditionally Phaco has been taught. Now, I don't know how many of you are academics, but we all know about the formal curriculum, but there's also the hidden curriculum and the informal curriculum, which are sometimes used interchangeably. And those are the things that we learn from our mentors outside really of the clinical teaching, get into work. So learning Phaco, which is the subject of this evening, is more than just learning about surgery. We learn about how to care about our patients, how to interact with our patients, how to deal with complications, how to explain complications to patients, because that's extremely important. So, you know, it's fine when all the cases go well and we talk about 2020 happy, but part of this mentorship and this role modeling is also how to deal with matters when they don't go well. So in closing, I just would share my experience with one I call my mentor, because many persons have taught me surgery, but I don't consider many of them mentors in that there was no lasting legacy. And in the center, this is Professor Colin Kirkness, who I worked with in Glasgow. And he used scaffolding to build my confidence in performing surgery, especially corneal transplantation, in which you built up the steps. And then one day he said, you're all on your own. This was unplanned. He didn't give me the opportunity to get anxious. He said, this is your case, I'll be next door. However, in addition to teaching surgery, he also encouraged me to take on other leadership roles in order to build my whole experience. So as a mentor, it's not just about surgery itself, but it's also developing the surgeon as a whole, or the mentee. He also recognized my skills and created opportunities for me to specialize in cornea. That's why I'm a corneal surgeon as well. And he remained available for professional advice. So I hope I've shown from my experience what I think a good mentor is. I look forward to the rest of the presentations.
Very, very interesting, Nigel. So he had a plan, but he didn't share it with you, right? That was interesting.
Nervous to sleep on it.
Okay, so we agree, right? The journey and the mentor. We all need this Yoda behind us, telling us, you know, the special things that we need to do. Again, the ones who are, you know, entering right now to the talk, the ones who can, you know, take a picture to that QR, they can come into this amazing community. You know, we can connect you with mentors. We want you to become the surgeon you want to be, you know, from zero or premium IOLs, or maybe you just complex cases, complications, everything you need, we will try to give it to you. And then again, you know, I think agree, we all are in some way, the little Yoda that we need to learn, you know, we need to keep always learning. I love what you said, Ben, about this. About the day before, I really love this. Especially when you're starting. I think if you do everything right when you're starting, it will be better for you when you're doing your first Phacos. You need to sleep, you need to rest, you need to eat well, you need to prepare everything you can so that in that moment you can have a peak performance, especially mentally, right? Mentally, you can prepare yourself to have this peak performance states before. In tip 4, I think it's very important to understand that it's not only yourself, there is a team behind you. And Ishtiake has amazing tips about this. Ishtiake, I would love you to share your knowledge with us.
Yeah, thank you, Ivo. I will just start sharing. Can you see my screen, Ivo?
Yes.
Right. So there is a saying that you tell me and I'm going to forget. And you teach me, I may remember. And you involve me and I'm going to learn it. So that is something that all the mentors should do. And while selecting a mentor or an institute, we should also be very particular, you know, as Nigel had said that he had a very good surgeon who knew how to do it, but was not, you know, ready to share with him or guide him how to do it. So we need to have mentors like you know, and the other panelists that, you know, would share that whatever they know and involve them in that manner also. And something that you just wanted to start that, you know, you want to be confident while you are learning that, okay, I have learned it, but in a way you should not be overconfident and do something harm to the eye. And you are going to have complications in the way. And when I teach, I see that I have two types of trainees. One that it says that, okay, you know, in your learning process, you're going to have complications, don't worry. And what I find that this sort of surgeons never go up to that mark. You know, they are very complacent and they would take the complications. But there are other type of surgeons who try to find out why complication happened. They would go to other surgeons asking what happened. They would run through their surgeries, record it and why it happened, and they become very good surgeons. One particular thing I would want to end with is that you should always rate how you are doing. There is a very good thing called Oscar by the International Council of Ophthalmology. That means that ophthalmology surgical competency assessment rubric. So you keep track of your surgery, every step, how you're doing. It starts from draping, and there is a score for everything, novice, beginners. So you know how much you are improving, where you are and where you are going. These are the couple of points that I wanted to share with you.
Thank you very much. Amazing, as always, short and powerful. We love you because of that. Thank you very much, Ishtiake. Ben, you have a couple of comments about this?
Yeah, I totally agree. I think you know, each point, you know, each step is so important, because one step makes the next step, if you get it wrong, 10 times harder. If you get your draping wrong, it makes the lashes get in there, makes your incisions difficult. So that's probably the reason why most of us got taught from the end of the operation forward, because you can't muck up the last step of the operation and make it harder for the next one. And I completely agree with Ishtiaq that if you think about the step as an isolated step and you score it and you think to yourself, you think back the next day, you look back on that operation, you think, what could I have done better? Sometimes you forget things like draping. So I love that that rubric. I think that makes a lot of sense.
Thank you very much, Ben.
Ben,
okay, and
just one thing I wanted
yes.
to ask to Ben, that when you are saying that, you know, that you see somebody else and that you think that I can't do it. So what would be your suggestion to the learning surgeons, that you master something and then you try something else? Or if you can do, say, for example, you are very good at stop and chop. So should you try horizontal chop or other things? Ivo and Ben, what is your take on this one?
Personally, for me, I think that learning new techniques is very good, because you'll always come across that nucleus. You know, Ishtiaq, when you have one and you think, oh, I'll be able to chop this, and then you realize, oh no, I can't. I need to go back to divide and conquer. And then there'll be some nuclei, those very soft ones, where you think, gee, what the hell am I going to do here? Because none of my techniques are working. And so I think having a a group of techniques. You can definitely have your favorite one, because most cases will be like that. But I believe in learning enough of those techniques to feel competent, but I think you'll always have one that you favor. Like you saying stop and chop, I'm the same. I go back to that. That's my chosen one. But I do have some other techniques where I feel comfortable if the situation arises. So I believe in not sticking with one, but probably learning in a safe environment, learning when you think the surroundings and the situation is just perfect for learning, not trying it on the difficult ones. What do you think, Ivo?
Well, I agree 100% with you. I think you always need to be learning, but I love what you said about not all the cases are good to learn, right? The surroundings going to be perfect. And exactly, we're going to talk about that. Julio has amazing tips about, the surroundings, what happens when the OR and the architecture, everything, because it's not only to just sit and do a couple of steps in Phaco, it's everything that surrounds you. Julio, what are your thoughts about this?
Hi everyone, good night. Well, the most important one is try to get a few minutes early to the OR and check which is your first patient. That's a lesson that I learned from my mentor in my fellow at Kofka in Barranquilla. The first case is the most important to you do a really good section of surgery. So the first case try to be an easy one, a normal cataract. So you need to go early to the OR and check what patient is that. Then when you enter to the room, you have to check three things: your staff, instrumental, the ergonomics, your chair, your foot pedals, and microscope, and your settings in the Phaco machines. So, like Milton said, the Phaco machine is like a car, and you need to know how to drive it really good. So you need to know how to change your settings, or if someone else moved your settings, that you can correct that change they did before you. And then work with your staff really smart. They need to know what technique you are doing, so the instrumental, be ready at any time, and you need to be prepared for any complications. So it's really important to check what patients you're going to do, so what instrumental you're going to need in that precise moment. And in the Spanish session, they said don't drink coffee, but for me, coffee is essential. So I perform the first surgery and I have to drink coffee. I don't know how to do it without coffee.
Yeah, and that's the good thing, right? We can see different things from different surgeons. Okay. So, sorry, I have an echo now. Okay. So it's very important, the architecture and how you put all your instruments and all the equipment. Juan Pablo, do you have any tips to share about this? How you get comfortable in the OR?
No, definitely. First of all, thank you, Ivo, for inviting me. It's really an honor to be with such a distinguished panel. Well, everything you said really has been very important. And I always look at cataract surgeons and surgeons in general as a sort of like high performance athletes, sort of like what Milton said, Dr. Yogi. So everything is about routine. Okay. So what we said at the beginning was sort of build up a routine as a surgeon. Whatever it is, like Dr. Atencio, he drinks coffee before surgery. I, for one, I don't drink coffee before surgery, even though I am a coffee drinker. And that's just something that stuck with me from residency. Even though I drink 3 or 4 cups of coffee a day, the day before surgery, I usually at night don't drink my coffee. During the day before, during the surgery, I don't drink my coffee either. So it's all about building sort of a routine. That's what I would tell, people that are starting up. Try to stick to a routine. It's sort of a lot of repetition. When we're talking about the OR and the surroundings, the tip before this, which was about your team. When I got back from my residency, from my couple of fellowships I did, you go to an OR that's completely different. So always get used to your new OR, to your surroundings. Like Julio said, your ergonomics are so important, because we could be sitting there for 10, 15 cases sometimes, or make sure that all of your parameters are as you wish, that you're sure that they're the ones you want. You can sort of touch and go with them, and make them better as you go on. As you grow as a surgeon, you'll find that you're changing the way you do surgery. Make sure your microscope the settings are okay. Your feet are fine. Remember, we do surgery with both hands and both feet. Make sure you're comfortable. That's the first thing you have to do when you get to the OR. Make sure you're comfortable. Make sure all your team is in place. Your the person that the person that hands you the instruments, your anesthesia person, the auxiliary nurse that's walking around. Make sure you're all on the same page. Make sure to train your staff to your liking and to the likings of the OR. I think that's very important to basically be prepared, be overly prepared. And Phaco Mentors is important because it's about over preparing. It's about training so that everything is instinctual and you sort of can adapt to any situation.
Wow. Thank you very much, Juan Pablo. That's amazing, and that's what I love. What we wanted 10 tips, but we want everybody to talk about everything, because this is an artificial division, because everything is connected, right? Thank you so much. Amazing words. And again, the surroundings are the correct structure of everything, but there's a lot of technology. We have a lot of instruments as well, and there is the patient, right? And when people are starting, they need to understand that there's a right patient to learn. Milton, you're very, very involved in education. Tell me, something very briefly about how you pick the right patient for somebody starting from zero.
Well, I think preparation is everything, and I think it is. Sometimes I see surgeons or fellows having trouble with some things that are already in the routine. They improvise too much, even in the regular cases. So I think it's important to really have and stick to a checklist, even for the relation with the patient, in terms of having everything checked with the patient, but as in the OR as well. So checklist is something that we are not used to have. I do have, I stick some papers on the surgical room as well, because I do make surgeries in different theaters. So having your checklist written for everyone with all your routine is very important. So the patient has the best safety procedure you can give him.
Amazing. And just a couple of small tips about this. This anesthesia, we could talk hours about anesthesia, but the important thing here is you need to have a good anesthesia. Okay, it can be retrobulbar, peribulbar. It can be, something that you do that you feel comfortable, but the patient is to be with the correct anesthesia so you can have a correct learning experience in the first one. We talk about the surgeon. We did talk about the mental state, about how to achieve this peak performance state. I think that's very important. Again, we could talk about 2 hours in how we can reach that specific state. I think it's very important to talk about ergonomics. If you wanna do surgery until we're 70, 80. Why not? We need to be with the correct ergonomics. And I tried to pick a picture, a recent picture of me with the most incorrect ergonomics ever. As you can see there, my spine and my cervicals are suffering a lot. You need, and we can talk this with the simulator, you need to have the correct ergonomics, right, to protect your body while you're doing microsurgery through a microscope. And the afterward, I think this is amazing. I think Ishtiake and many others talked about this, what happens after surgery, right? That's very important. We need to talk about what happened. That happened in Barranquilla, Colombia, with one of my, our amazing mentors, Dr. Escaf, in his meeting, with videos, discussing with colleagues what happened, what we did right, what we did wrong, and I think it's very important. So let's go to the interesting stuff. Let's go to Phaco dynamics, and let's go to surgery, okay? So I'm gonna stop sharing the screen, thanks God, right? And we're gonna start using this amazing technology I have right here, and I would love for everybody to interrupt me, when they can. I know Ben has this machine around, and there's many other colleagues who know about the simulator, and this is a game changer. We talked about the importance of when we learn to be ready in the surroundings that allows you to learn. And here, we're discussing, we have a simulator, we have a table with artificial eyes, instruments, everything we need from viscoelastics to blades. So that's the most important tip I will love to share with you. Let's start with capsule rhexis with this machine, because it has many important things. You can see here, this is the demo software, and you can have basic skills here and surgical skills in the other way. You can do capsule rhexis, hydro dissection, Phaco divide and conquer, irrigation aspiration, IOL insertion, iris expansion, and most of all, anterior vitrectomy. We can learn about anterior vitrectomy. That's very important. We have 7 different levels to be a master in anterior vitrectomy. So every time you get a better surgeon, you do it less and less. So how can you master something that you do with no frequency, right? So let's start with capsular rhexis, for example. And when we're learning, I will love all the panel. Please interrupt me at all times. But I will start as when we have students. I deconstruct the task in simpler tasks. That's very important to learn, right? We don't need to do a complete capsular rhexis in the beginning. We can put a guiding element. We can put viscoelastic. We can have an initial tier, and can be clockwise or unclockwise. So when you start, you just want to run, right? What do we want to do? We want to run into surgery. No, incorrect. Remember, guys, we need to have the correct ergonomics. When you do Phaco, you have your 2 feet, and you need to see through a microscope in 3D. The correct hand position, it's everything for you when you're starting. And you can see right there that I'm doing a capsular rhexis that has a guiding element and a flap with viscoelastic. And then again, you can feel my hands, because the secret is here. It's not what is happening in the YouTube videos you want. It's what happens outside, and how you put the correct, how you have the correct hand position, how you do the movements to have an eye that's centered at all times. And you can see, and you can perform the correct vectors also at all times. So you control that capsular rhexis. This is a very, very interesting step in simulation, and it will allow you to master it, as you can see there, with a centered eye. And let's grab here. Let's try to do it fast. It doesn't matter that. But what I want to show you, right, is what happens afterwards. We can discuss about what happened, and we can have objective metrics of what happened. Okay, so the machine will tell you how round it is, how centered it was, is it deviated. So I would love to talk to the panel. What do you guys think? We're learning capsular rhexis in a completely different way, with objective feedback. We can discuss about my hand position. Maybe somebody didn't like that it was doing sharing or whipping. let's start with the last one who talked. Nigel,
Yeah.
what do you think about this?
You mean your performance?
About everything.
Yeah, I mean, I think deconstructing or scaffolding is very important. The manual control. You know, once you master the technique, you forget that there's actually not a pretty difficult technique to learn. Just getting your curves correct, how to tear something into a circle, and also not being too aggressive, making sure your chamber is deep. That is very important in controlling your forces, because if your chamber shallows, also you tend to run, and also holding your flap in the correct place. So those things can be well taught with a simulator, and there's so many fine things in capsulorhexis. You know, from the outside it looks like you're just staring a circle, but those little things make
Exactly.
you just hold the flap in the correct place and it starts to run. So it's very there are so many little steps. Sorry?
No, sorry. It just disconnected for a little bit. So interesting what you said, Nigel. Then again, talking about everything that surrounds this, right? Everybody looks at a video and says, "Oh, you're doing a circle. That's easy, right?" And then when you understand that there is an eye here that needs to be centered, that you're doing micro movements, you know, with your hands, that needs to be stable, because you can push the incision, viscoelastic will come out, that rexis is going to go out. There's so many things that can happen. But guess what? This is an amazing thing, and we love Harry, Ishtiake, Milton, please. You know, we're all seeing each other. But I'm going to try to do a capsulorhexis with my left hand. And this is not because, you know, to show off. It's to see if, you know, the information is in my brain. Because it's going to take me, it's not going to be easy for me, right? But there's many things that I learned in the past that will allow me to do a capsulorhexis with my left hand. Milton, Ishtiake, what do you think about this? Juan Pablo, please.
Yeah, so rexis is very hard to learn for the trainees. That's what I found. This is the one of the steps. It's in the early part of the surgery, and as Ben said, that you mess up one step and all the steps after that. So whole surgery is after that. So rexis is very important. Ergonomics, where you hold your say rexis forceps or cystitome, it's so important. And if you have a simulator, you can practice. It makes your life very easy, and you are confident once you move on to the real field. You know, you have your patience and you're not thinking too much. You know that you know how to move your hands, where to rest it. But I would just ask you, you know, how many steps in simulator would you usually takes the trainees to move on to the patients, you know, in your experience?
Oh, now you're doing a good question. That's a very good question. And that's something that is called consistency of performance, right? So you need to show me that you're good at it. It's not, it wasn't luck, right? You need to do it with a certain score for 3 times at least. That's a very good question. What do you think, Juan Pablo? You were able to use this machine.
Yeah, well, I did use the EYESI when I was in residency in Colombia. I didn't get to use it when I was in Barranquilla, because literally the month I left was the moment where the machine came. But in my experience, it's a wonderful machine. It gives you what you were saying, consistency. So you make sure that you're constant with your performance. When we don't have the EYESI, because a lot of countries, a lot of people don't have the EYESIs, there are different methods to really train for capsulorhexis. We used to use certain types of, I forgot the name of these eyes that we used to use that were cheaper. Also certain papers. And when I was in residency, we would have to make, I don't even remember, more than 1,000 rexes on eyes, on pig eyes as well, in order to move along. But it never really emulates the real thing completely. The closest thing is the EYESI. And one of the things that I remember when I was a resident that would make me make mistakes during the rexes was basically putting a lot of pressure on the back part of my hand and would press the eye. And when, like you would say, that would make the rexes run. So really, when you're starting to do the rexes, you have to be sort of in that state of mind. And obviously everybody's extremely nervous when you start doing the rexes, and just take it slow. Make sure you have the knowledge and the theory of how to recover rexes, because a lot of the process of rexes development is really how to recover when the rexes isn't coming out perfectly. And we know the first couple of cases, first couple tens, 20, 30 cases of phaco surgery, your rexes won't be beautiful. They will be a little bit, not uniform. And be patient and be constant. And at first, at least be with someone. That's the important thing of a mentorship. Be with someone that can recover a rexes, especially during your training at first.
Very good, Juan Pablo. I think you talk, again, I love what you're saying, because you're talking about the three pillars we were talking, right? You talk about the motor skills, you're talking about the cognitive skills, what to do, what this decision making, when the rexes is not going good, and the mental state. Agree 100%. I was able to do it with my left hand, and it wasn't a show off. It was to say that something it's, inside your brain and the vectors and how the rexes behaves, that, it will stay at your brain. And if you train a lot with your left hand, I think everybody will be able to do it. But that's then the thing, is it ethical to train that with a human being? That's another question and another talk. Yes.
Dr. Ivo?
Yes. Yes, Harry, please.
Is that simulator can simulate fragile capsule?
Sorry.
In my I have ever operate the patient with fragile capsule, so it can be Argentine and black.
I understand. You can shape, and there's limitations, but when you go to that with that step, you can simulate weak sonula, an initial tear that is going out. You can share a white cataract, for example. You can do a white cataract, stain it, and do it, with high tension. That's like a pancreatic cataract that the rexes were going to go off. Yes, you can shape the reality in different steps. Let's go now to phaco. Just because I think in phaco emulsification, there is something that changes, right? You can do extra cap, and there's many surgeons that do extra cap that it's really hard to move on to phaco. And that's because I have this concept, and I love this concept about that phaco emulsification. Actually, phaco emulsification of the nucleus is synchronization. It's 2 hands, 2 feet, and listening to a machine and see what's happening and adapting instantly to what's happening inside the eye. So let's do, for example, and let's do some mistakes, because this is the cool thing, right? I can make a mistake here, but there's no repercussion whatsoever. So I'm going to do a divide and conquer, for example, right, guys? And you're going to understand that we can train and discuss about what's happening with the correct ergonomics, 2 hands, 2 feet. Let's do phaco emulsification here. Let's see if you can see. And please, the panel can interrupt me at any times, and then we can go to the artificial eyes to do a couple of incisions and many
Ivo, can I ask you something?
things. Yes, sure.
I was just going to say, I know that through my training, we didn't have this machine, and I tore quite a few capsules, and my supervisor would get angry at me and he'd say, "You're very good at anterior vitrectomy, but I wish you weren't." And how do you? Part of that for me was the mental side of it. When you're doing this simulation training, as Juan Pablo was saying, you get anxious. And how do you simulate that environment for your trainees?
That's because you're very good, and that's a very good question, Ben. But I think in the beginning, you need to take the mental aspect. You can take it out, right? And you can make people understand the algorithm and the motor skills. But then I will do it. Because, for example, I will raise scores, or I will raise repetition. I'm going to be here next to them, pressuring them. And there's many ways, you can pressure, a colleague, and that's very interesting. let's see if you can you see me here? Yes,
Yes.
right? So let's see if you can see my screen. Can we put the screen a little bigger? Let's see if we can, put my image big so you can see what I'm doing. There you go. Perfect. So, I'm gonna do sculpting, right? So as you can see there, I need to enter the eye position 1. So already I'm using my right foot, and then I'm understanding how depth is this trench, and I need to go doing position 3 and sculpting this lens, okay, in the correct depth, so I can start and doing, a correct trench so I can crack this lens. So the depth, I think it's correct. I can put the second instrument, and if I go down and I go to the sides, it will fragment, okay? Perfect. So then I can rotate that lens. So imagine I'm using my right foot, my 2 hands, and then I'm, always with my left foot, I'm focusing, and I'm gonna do a second trench. Okay, right here, I go slow, the lens is behaving correctly, but then, I got distracted and oops, what happened? I had a posterior capsular break. Can you see it there? And the machine is telling me, oh man, there's something wrong happening there. Can you see it? I have a right hole there. So as you were saying, Ben, then I can tell you, if I have a student here with this posterior capsular break, oh, these guys are gonna be nervous. So I'm gonna be acting some stress here. The mental is gonna be, and that lens, if I push it, it should go down to the videos right there, okay? So there's many things that could go wrong, and we can talk about why complications happen and do it again and again. And I think repetition is great, but especially here, guys, what I wanted to show you is that we are really truly exercising about synchronization, right? I'm hearing in the machine, my left foot, my right foot, my 2 hands working. What are your comments, guys? Milton.
I have a great experience with IC. We have here in São Paulo a simulator, the IC within the IPEPO, the Vision Institute, and we share the equipment with all the residencies in Brazil. You schedule a time to use it, and we have a partnership with a pharmaceutical company, which is Latino Pharma, which kindly entered into this project. And so, although I have a great deal of experience with IC, I do also have a group of nerds in ophthalmology. We call ourselves as med hackers. And I'm going to show you another way to also perform your training. Can you see my screen?
Yes.
So this is a hacking. So in our med hacker group, in which he used a simple kitchen funnel and a ping pong ball, and he devised a gadget in order for you to train at home. We also, excuse me, we also showed off this in an event in Brazil, in which the participants learned how to do it by themselves at home and train. It is due to this colleague of ours, Farley. He had this invention. And so this is the other side of the simulation, a very cheap and homemade. Regarding the question of how do you keep your coolness during complication, I'm going to give you a very, very, very important recommendation regarding stressful times. It all relates to previous training. There is an error that everyone advises, that you have to keep your calm during stressful complication. It is the same as asking for the pilot when he has a burning jet engine to keep calm without having his training or simulations. And this, for example, is a training for posterior capsular rupture, in which these are preceptors of residence programs, and we ran a program in which they had all the steps, and they trained a lot, during the whole day, not only the technique, but also the steps to deal during a complication. Am I sharing? Still sharing?
No, no, it's not
Oh,
sharing
sorry,
anymore.
sorry.
Oh, don't worry, don't worry.
But
Let's go
anyways,
to the, because I think it's very important what you're saying, Milton. We have different tools. The important thing here is talking about simulation, talking about the power of simulation, the power of communication when you are doing different things. We did big eyes many times, you know, before residency, but then there's something called fidelity, right? That it's about how reproducible it is in a human being. And in simulation, we don't want things to be exactly the same, but we want things to help us mimic everything that happens. For example, in these eyes, these guys are amazing friend of us, the guys from Bionico, that not only has the eye, right? Because it has the front head of the patient, so I can put my hands in the correct position. Let's try to fixate this image, please, if we can, si podemos fijar esta imagen, so I can share, you know, a little bit about the hand position, about the fidelity of the eye. Look at that. That eye and that anterior chamber looks perfect. It's completely amazing, the quality, and you can see the lens in the back. And you can also put your hands in the correct position so you can work on it. I don't want to forget about other guys who are really good friends. Look at these guys. The micro guys with Federico is a good friend. He will allow you, you know, to record your surgeries in every single microscope. So I recommend that too, because, you know, we were talking about seeing your own surgeries. Okay, for example, in this example, I'm going to do an incision. Please, Lisa, si podés fijar la imagen aquí para que la gente vea, ¿sí? Solamente esta imagen, por favor. Okay, so let's do an incision here, guys. For example, you can see my hands in the correct position. You know, I can grab the eye and fixate it, and then I'm doing the incision. This is not correct if I don't have the forehead of the patient and I'm, you know, trying to float and don't know the correct steps. So it's very, very important, guys. Try to mimic reality as much as you can and to have the correct technology. Especially, and people who know me, I am completely obsessed with the hand position because I think hand position is the real secret. In this case, I'm going to do the incision. We were discussing with our colleagues that I do a two-planar incision. I just mark, you know, one plane, and then I will do, you know, this is a very important tip. I also see the reflex of the light right here to be uniform, so I am in the correct place, and I will, you know, just do a first plane and then a second one. And the important here is what I like, the in and out in the same way. The most common mistakes is if you don't put it in the correct plane like this, or the second thing is when you're going out, you make it bigger, right? But those two tips, you're gonna do an amazing incision. What do you think in the panel?
For the panel?
Tell me about your incision.
Well, I changed my incision with time. When I started, I start with triplanar and preset like you did. Then with time, I realized that I can perform incision in one plane. I think the most important thing is to have a good tunnel with like almost 1 centimeter of depth. But for me, since 8 years ago, I performed the incision in one plane and I stopped using the shooter at the end. I put air and it worked for me, very hermetic. But you can try triplanar, biplanar, and in one plane. If you do it correctly, it works every time.
So I
Perfect.
think two very important things
Yes.
you have shown, you know, hand position. And this is something that is very important, you know, how you rest your hand. Because in the initial period, the surgery takes half an hour to 40 minutes. So if you are not positioned your hand correctly, you know, they become tired and sometimes it becomes so heavy. Even a Sinski hook, you know, you feel that it weighs a kilogram. And I had a student who was struggling, and I found that she was holding her hand in the air, you know, not resting on the forehead or the cheeks. So everything, if you have a simulator, and exactly you have said that, you know, try to be as equal to that real scenario. So don't try it just on the only the eyes. Rather, you know, have it in a socket. So you have forehead, cheeks, and everything, because you know, nose hampers, and incision is something that is very important. You know, if you have a two posterior incision and there is ballooning, it will make your life hell. So you have to be very particular on every points. It's excellent points.
You know
Thank you. Juan Pablo?
what Julio was saying, and piggybacking on that, and what Dr. Anwar was saying. Well, obviously, the incision is basically one of the first steps in surgery, one of the most important ones. All of them are important, but if you have a bad incision from the get-go, it will be a complicated case. It will just be like Anwar said, Dr. Anwar, it'll be hell, basically. I, like Atencio, have changed my incision throughout the years. I started superior, now I do temporal, for example. Also, I used to think that smaller was better. So when I started training, it was probably a 2.7 incision. Then I went down to all the way to 2.2. I even tried a little bit of 1.8, which was horrible for me. Then I went back to 2.2, and now I'm actually going up a little bit back to 2.4. And the reason I bring this up is not to like tell you the story about my incision, but the importance of your posterior after surgery, and that I'm sure we're going to talk about that in something else, because we could be a day talking about it. It's about your results and how incision size matters and how incision positioning matters, and the importance about tracking your results afterwards. If you don't evolve as a surgeon to become a better surgeon, especially when you're a young surgeon, then you really can't get better. And you're basically just repeating an act over and over again. You have to try to evolve and become a better surgeon, become part of that 95 percentile, you know, that have better results for your patients. And the way to do that is to basically track your results and track your incisions. And I mean, what you said at first, hand positioning is the first step and probably the most important step in beginning to start an incision.
What was the reason, Pablo,
we're waiting
for
for news
change
from you about that.
4 to 2.2? What is the
Excuse
reason
me?
for you? What was the reason that you have changed from 2.2 to 2.4?
Well, it was actually a conversation I had with Dr. Warren Hill. So we were talking about surgical induced astigmatism and centroid function, and it's something that obsesses me. And my surgical induced astigmatism was up to about 0.14, which was a little bit high, and I was doing a 2.2 incision. He suggested to go back to a 2.4 to lower it a little bit more because of the tension of the Phaco in the incision will actually induce more astigmatism. And it actually worked for me. I brought back my induced astigmatism to about 0.07. So I basically halved it just by changing my incision back to 2.4. So yeah, that's basically it was actually a suggestion.
Guys, I know you love Phaco, and you know this is what we're coming from zero, guys. Yeah, we need to talk in English. No, but this is an amazing discussion. Juan Pablo loved this matter. you know, he has amazing news for us, but we're still waiting for him. You know, I want to say this out loud so he can, you know, we can push him a little bit. He has amazing technology about this. We're finishing, and I would love from everybody in the panel, you know, to do a little, you know, a short comment about what happened. This was touching so many different things in the surface. We can go deep in so many things. But first, I want to thank Jorge Hernandez. Okay, Jorge Hernandez was translating all the time to Spanish. So thank you, Jorge. And come here. We have the best cameraman right here, guys. Amazing colleague also from Uruguay, Juan Manuel. It's an amazing colleague from Uruguay. He's helping me, you know, with being a cameraman. And we're 2 Uruguayans in Mexico, so we are a lot of Uruguayans, right? In Mexico, we're well represented. So I hope this is the first of many activities. I would love to have you guys again here. Seriously, this is your house. Ishtake knows this. He has amazing ideas, and I say, okay, next week. No, we're not gonna wait. Okay, you know, we need to start doing activities. We have the technology. We love to teach. We're building an amazing community from all over the world. Harry, it was such a nice thing to have you here, you know, for far away. Nigel, a very, very good friend from Barbados. You know, you need to visit him. Barbados is the best, you know, country in the planet for sure. So you can start, Nigel, with some words to finish this activity.
Yeah, I think it was awesome. I hope that there are many residents watching, because in training is without good instruction, these subtleties that make such a big difference to your success in Phaco are not that obvious. Like hand position, I mean, I've seen residents who are just looking for the bigger picture. The sculpting or whatnot, and not really paying attention to your incision, how you hold your knife. So, and then we already mentioned the subtleties in your capsule rhexis. So Phaco is a wonderful procedure, but each step has to be mastered. And, you know, I always say that I do transplants and I don't get nervous before a transplant, but I do because any little step that doesn't go according to plan can actually change the whole course of the surgery. So thank you for inviting me, and I look forward to further collaboration.
Yes, Nigel, thank you for being here with you, and let's hope we can do many other activities. Guys, before we finish and the other panelists talk, remember tomorrow, amazing worldwide release about a new technology for corneal transplant. You were talking about corneal transplant, Nigel, and I remember we have an amazing panel from all over the world. This is going to be historic. So, and the price is 1 endokeratosis prosthesis, and those again, the ones who want to apply to the program, have a mentor, you know, to train themselves, they can take a picture from the QR, you know, give your data, and, you know, we're going to try to help you as much as we can. So just to follow the order, Milton, you're next.
I congratulate all the speakers, and especially you from Oftalmo University. And I really hope we have more of these interactions, because, as you said, there are so many topics and very important ones, and we just scratched the surface. So thank you so much for the invitation.
Oh, this is your house, Milton. Thank you for being here with us. Amazing histories, amazing tips as always. Ishtake, my brother, actually I see, you know, Ishtake is like my brother from the other part of the planet.
Opposite side, yeah. I would say that, you know, find a enthusiastic mentor like Ivo and all the panelists here, and that's one thing. That mentor is going to just push you up there.
Thank you very much. Ben, always a pleasure. This is your house too.
Thank you. Thanks, Ivo, and thanks all the panelists. It's been a real pleasure. I think if I had to sum it up today, it's probably comes from Milton's talk that, you know, it's like sport. You got to prepare, and when you get on the field, don't feel like you have to take the game-winning shot right away. You know, get your feel, get comfortable, get into it, and you know, training is key. So yeah, thank you very much. I really enjoyed it.
Oh, thank you, an honor. Harry.
Yes. No more. I said thank you.
Thank you. It was an honor to have you. Juan Pablo.
Again, thank you, Ivo. You have a wonderful team. Really, this is a great platform for everybody that's learning. Again, piggybacking on what Ben and Milton said, training, preparedness is the key to really have success. And I think that's probably, if there's one thing people have to take of this, is to prepare.
Thank you. Julio?
Well, just to say that stay tuned. We're gonna continue doing webinars, masterclass of each steps, and thanks to all the panelists. It was a really nice session, and keep training. Discipline defeats talent. So if you are disciplined like the Japanese, you're gonna perform and be a great phaco surgeon.
Thank you very much, Julio. Thank all the panelists, and I hope this is the first of many. Okay, guys.
Thank you.
Thank you.
Stay safe, and talk to you soon.
Bye.
Bye, guys.
Bye.
Take care.